Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Today's topic is a little heavy, but something that needs to be addressed, and I'm really excited to introduce you to Dr. Vinay Aggarwal, Assistant Professor from the Department of Orthopedic Surgery and Associate Fellowship Director of Adult Reconstruction at NYU Langone Health.
Thanks, Marnie. Pleasure to be here with you. And it's a really important topic that I think a lot of us are passionate about. So thanks for having us.
And last but absolutely not least, the gentleman who insisted that we add this to our FPA course that we ran in New York last December, and quite frankly was one of the best sessions I've ever seen, Dr. Josh Rozell, Assistant Professor at the Department of Orthopedic Surgery, Division of Adult Reconstruction, and Chief of Orthopedics at NYU Brooklyn. Hi, Josh.
Hey, Marnie. Hey, Vinay. Thanks for having us.
Well, we intentionally left off physician from this topic because I think burnout is something that plagues any stressful role, whether it's direct patient care or on the business side of healthcare. So let's go ahead and just dig into this. Studies show that the rise of burnout is ever increasing in all career stages, and one heartbreaking and sobering fact is that the incidence of suicide, especially in orthopedics, is rising and in the double digits. As leaders with trainees under you, and let's go ahead and start with Josh, can you share the ramifications of not addressing burnout at an early stage in your career?
Yeah, certainly. I think, again, like you said, burnout's one of those things that we really don't talk about very much, and certainly residents and trainees are not educated about burnout during residency. So a lot of times they'll have symptoms of it or they'll experience it, but won't really realize what's going on. And then they'll end up having to, it'll just snowball into some much bigger thing than it might need to be because they don't know that they need to ask for help. So, I think that the ramifications would really be that the quality of the work that you're doing suffers. You're becoming emotionally exhausted. You think that, potentially you're not doing the right, you're not in the right field, maybe saying orthopedics is not for me or whatever field you're in. And, I think that the single biggest threat to a doctor's career is not complications, it's not litigation, it's actually burnout. And I think by not addressing it early and not understanding what it looks like early, I think the ramifications can be even more severe.
Yeah, Josh, I think I would echo that. When we were training, Josh, both you and I don't think the word burnout even existed. As an intern, I don't think I ever heard the word. I do feel like we're hearing the word again and again now. But to your point, it's less that we're not hearing the word nowadays and we're not hearing enough about it. It's more that we don't really know what to do with that word when it comes to our trainees. And does that mean we need to do something early to prevent it? Is it preventable? I think these are all questions, and the reason Marnie's having us on this call is we need to be able to answer some of these in a preventable fashion going forward. And so I'm excited to talk to Josh about that.
So this is open for both of you, and maybe we stick with Vinay. I agree. When you entered medicine and when I entered, healthcare 16 years ago, you didn't hear about burnout. You heard suck it up, stop being weak, things that people, which probably led, to a faster incidence of burnout. What in today's era of things that you can say, can't say, things that you can't say to certain people or that you could say to others, but not, where do you even start?
Yeah, it's definitely a different era that we live in. For the better, for the most part of all of our well-beings. That being said, I think it has to do with expectation setting at a very early age, at a very early stage in your career. And I found that communication early and often, whether it's in your personal life or professional life, really leads to prevention of dissatisfaction and lack of feeling like you have control in your life. And that's step number one. Lack of control, lack of expectations. I think that's a fail-safe way to start a trajectory down burnout. And so we really do in our jobs, training medical students, residents, and fellows, try at the orientation stages to set expectations and clearly communicate that this is what we expect of people, whether that's on a certain surgery we're doing, a certain year of training, or just for their careers overall.
This really starts when you're a medical student. We have all these fourth-year medical students who rotate on our services, and it's really their first experience with orthopedics, and they're thrown into this world where they don't understand the language and they don't necessarily understand the culture and what we as attendings and residents and fellows may perceive as, a joking environment at some points of a case, or just a very lighthearted atmosphere, they may interpret as being very, either hostile or, a little bit unsettling to them. And I think by having those feelings even before they start as residents, it could shape the way that they progress throughout their first few years.
What are the signs that you both look for, and are you actively looking for them in your trainees?
Yeah, I think, one of the most important things is, we went into orthopedics because we love what we do. And I think when you start to see people who don't enjoy the cases anymore as much, or they don't, let's say they previously showed up on time all the time and now they're late to things, I think it's really just a change in their pattern of behavior that's totally the antithesis to what you would think their normal character is. So, not putting as much effort into their consult work, or not planning for operative cases, or not staying late to do the cases like they normally would. All these sorts of things that may signal you to say, I wonder if this person is really doing okay, because they're not really acting the way they normally do. So I think a deviation from their normal pattern of behavior is important to look out for. That's one of the biggest things.
Yeah, it's a really good point. I mean, definitely the change in somebody who was previously happy and now is sad, just to keep it as a simple terminology, that's definitely something it's an automatic red flag. But you're right, Marnie, sometimes you don't have the luxury of meeting somebody and knowing what they were like previously. So earlier in our trainees, we need to identify, who is not engaged from the outset. Like, why are they not engaged? Is there something that we're not addressing in their personal lives? Are they not, satisfied professionally? Are they not getting out of training, even in the first stages, something that we want them to get out of it? Or are they not connecting with other people around them in a meaningful way? And so all of these lead to interventions from supervisors, including ourselves. Oftentimes it's up to the people at the higher ends of the totem pole to try to lead and by example, but also get a lay of the room and read the room for who's interacting appropriately, cheerfully, joyfully, and who's not. And the ones that are not engaged are probably the ones that are most risk for burnout.
That makes sense. So from that stance, and NYU, huge amount of faculty, I think the largest residency program in the country, for your institution, is the faculty actively talking about this and addressing it, and even maybe putting together a playbook or a blueprint of, the next steps and how they intervene? And then B, as you go to large conferences like Academy or like AUKUS or, IOEN, are attending faculty talking about it and sharing best practices from institution to institution?
Yeah, so I think we have gotten much better at, as a faculty, addressing this without the trainees in the room, for example, and getting ready for this conversation. Like I said, this was not a conversation 10, 15 years ago, but it certainly is on a very frank level now, starting with our boss, Joe Zuckerman, from day one. So the faculty, the short answer is yes, we do have sessions amongst ourselves about how to address this. It's not like a playbook. It's more of a expectations on communication, doing things like 360 feedback sessions, evaluations where we're getting evaluated, we are evaluating our trainees, but also bringing up things that are not so much just textbook, you perform poorly on a test. It's more about how do you feel about your life? What's going on with your personal life? Are you satisfied? Are you professionally getting what you need to? And some of those evaluations go a long way. We're still trying to perfect those. At a national level, there's a lot of discussion about this, whether it's the AAHKS, the AUKUS meeting, Hip and Knee Society, AOS. There's a lot of sessions on burnout, and I think there will continue to be until, hopefully, our rates of, like you said at the beginning of this conversation, physicians leaving medicine, starting to do side gigs, physicians unfortunately hurting themselves, all those rates, when they go down, I think we've done our job. But the conversation should really never end.
That's great that you're seeing more and more, on a national level, and societies address this. I think, to that standpoint, just having been female, minority, double minority, an Asian female in orthopedics as a device rep even 16 years ago, if I had thrown out the word burnout, I probably would have gotten punted out of the OR and maybe even blacklisted, from that hospital for a little while. So it's really good to see that. And I would assume that it's going to take a while for this to become still normal place. Are you seeing any hesitancy from your residents in addressing something like this? I mean, you mentioned 360s. I think that's amazing that you're doing it in all aspects of life, not just on, standardized testing and stuff, but are you seeing any hesitancy from your trainees in being willing to respond truthfully to some of these questions to start indicating on burnout? Or are you simply looking closely at behavioral changes and patterns that Josh alluded to?
I think that's a great point because, with so many faculty and so many residents, it's hard for some of the residents sometimes to feel relatable to the attendings, and they may feel, scared to ask or scared to bring it up. So I think that, by having so many faculty, it allows the residents to really seek out some of the faculty that they feel most, relatable to, and it just eases the conversation. And a lot of our faculty are resident advisors. So every time we get a new class of interns, the interns get assigned a faculty advisor. And it's not necessarily like Vinay was talking about just, how are you performing on the test, but how can we get you acclimated to residency and how can we get you comfortable this is really the first job that we have, as residents. And even though we're not really getting paid much as residents, most of our friends and colleagues have been, in their field, finance, banking, law, for much longer than, we're starting out with our job when we're, 27 years old. So it's a huge disconnect between, all the other jobs and these jobs. And I like that you mentioned the sort of the gender gap here because, realistically, the studies have shown that females are about 50% more likely to have symptoms of burnout compared to men. And even when they have those feelings are more internalized with greater anxiety and depression. And 25% of residents are anxious or depressed, whether they say it or they're not, or have outward signs of it, they are. And I think that if you look at people like Bill Gates or Oprah or, Hugh Jackman, these very famous people who are very successful in their careers, all these people have life coaches. They have people who they talk to about these exact things. How can I navigate certain life situations that I've never been in before? And having somebody who's objective yet understanding is extremely important in your mental growth and your growth in your career.
I really like those examples. I think that, it's funny, Marnie, I was listening to the Oprah Winfrey podcast with my wife on a car trip to DC. You're going to laugh at this, but it wasn't my choice to put it on, but I really learned a lot actually
Sure.
out of it. So I put it on and it was all about what Josh is saying in that, society as a whole, there's just so much that is going on these days. We have so much access to information, social media, seeing how other people are doing can really lead to some significant anxiety issues. And they were discussing that it is very common in females. Obviously, it affects everybody, males as well. And it goes back to just some fundamentals of establishing people around you that care, being sense of a part of a community, and doing a job where you feel like you make a difference and have a purpose. And some of these tenets and fundamentals I was listening to, I was like, these really resonate with me. So you go, girl, Oprah. That was a great, podcast. I think that was literally one of the best things I have listened to in a long time. And it wasn't just applicable to doctors or physicians, but society as a whole. So I think Josh's examples are right on point.
I'll be honest, I didn't have my burnout until I'm currently 44. I had my burnout at about 40. So we had gotten through, COVID. I had ramped back up in my travel. And then I, kind of paused, because one extremely busy consulting contract ended and I was revamping other things. And I found this enormous amount of anxiety and depression as soon as I ramped down, because I didn't know what it felt like to not be in constant fight or flight. I didn't know what it felt like to sleep in my own bed for more than 2 days at a time and not come back for 15 hours to do laundry, repack, hop on that next plane. And probably clinically depressed, right? So what are the stages that if someone's in it and they know that they're not feeling right, but they don't realize it's this, that you could maybe kind of trigger for them? Do they go ask a friend, hey, am I acting different? Or, because to the point, you two are actively watching your trainees. The good news is you get to watch people perform on a regular basis. Most people don't have that in their lives. So how does someone who doesn't have someone watching them perform and can point out behavioral changes and pattern shifting, identify these stages and get help?
Yeah. So, first of all, thanks for sharing that you had this episode of burnout. I think, the first step for people to be comfortable with it is to understand that other people are going through similar things and have similar situations in their lives. I think, early on, I think burnout in general is typically found in very highly motivated individuals like surgeons. So basically any of us. And I think it's really defined by three major things. I think the first thing is, you become emotionally exhausted. So, all the things that, you went into the field for don't really matter as much, right? You just become so tired. And as a result, things become less, depersonalized, meaning, the intrinsic satisfaction that you got from helping a patient or, performing a certain procedure, you just don't get that anymore. And as a result, you sort of have this very low sense of personal accomplishment. And, those I think are things that you want to look out for. But, similar to the Kubler-Ross stages of grief, I think one of the first stages is also denial. You don't want to admit that this is actually happening to you. You're in a field that's, predominantly male dominated, very type A personalities. And especially as a female, you don't want to sort of, if you are having symptoms of burnout, sort of admit that, because you don't want to seem weak, like you mentioned before. You don't want to seem like you're, you can't perform the tasks, because, the reality is a lot of the female residents that we have here are much better than the male residents. So I think that, just because you're having these symptoms doesn't necessarily mean that you're a weaker person in general, or you are, more prone to having a tougher time. It's these symptoms, and burnout is universally, men, women, race, gender, all these different types of things. It's just super common. But I think denial would be really the first thing. And then all those things that I mentioned, the emotional exhaustion, the depersonalization, and the low sense of personal accomplishment.
So let's segue back and focus solely on physicians, with the demands of patient care just never ending. I mean, I've been to conferences with, physicians where they're jumping up out of, dinner or out of a breakout session and, calling a patient or calling their office back. We hear about the labor shortage in all of the support roles. So it's harder to find staff and, getting the block time you need because, you just can't run as many ORs, etc. How could a physician properly balance the need to give the proper amount of care and at the same time avoid burnout?
Yeah, this is something my wife and I discuss a lot. So my wife's a gastroenterologist, and obviously I'm an orthopedic surgeon. So two doctors, we see our friends in other fields, right? Whether it's law, whether it's finance, whether it's marketing, advertising, consulting, or even just, something less, maybe relying on a professional degree. But there is a lot of compensation in a lot of other fields for extra time, overtime, time outside the traditional workday. And I think that as physicians and surgeons, it's hard because you've gone into this profession where the expectation is clearly that you took a Hippocratic oath and you are going to put your profession on a pedestal and go above and beyond for your patients day in and day out. Now, I think that's noble. I think that's reasonable. But the whole point of this conversation we're having is that if you can't be there for your patients because you're burnt out, who are you really helping? And so it's definitely a fine balance. And Josh pointed out that you no longer take the personalization into things. You don't see the patient in front of you and treat them with the same care you may have if you weren't burnt out. You may not do the surgery with the same dedication, enthusiasm, effort, and attention to detail as you would have without being burnt out. So just because you need to tell yourself, just because you're doing work, you're going the extra mile and think you're calling back that patient after hours, or doing that extra surgery, or spending extra time on the weekend and taking more call, you may not be doing your patients the service you think you are. And I think a perfect example of this is when we're sick. Now, as surgeons, we, like you said earlier, with the orthopedic mentality, you kind of suck it up, you operate when you're sick. But nowadays, I think it's much more acceptable, and probably rightly so, for trainees and even faculty members to say, hold on, I'm sick. I shouldn't necessarily be handling a knife, a saw, a large piece of machinery in somebody's body if I'm not at 100% or close to it. And I think that, when my wife and I talked about that, it brought me back to realizing, she was like, I wouldn't want somebody who's sick operating on me. Maybe you shouldn't be doing that. And I think that's kind of an important aspect of thinking about how patient care, although it's noble to do, you have to take care of yourself first if you're actually going to do patient care well.
Yeah, I totally agree with that. And, obviously Vinay's wife is in medicine. My wife is not. And, while she is extremely understanding of the demands of my job, it's still, it's never the same if you're not married to a doctor. That sense of understanding and that intrinsic need to be connected with your patients is never truly, grasped unless you're actually really ensconced in it. And I think in the era with, Epic platforms and, patient portals, and the fact that patients have the ability to contact you at any hour of the day is a real onus on us, because, throughout the day, I can get 100 patient messages. And if I don't respond within, an hour or so, they're like, oh, where, why aren't you answering me, kind of thing. And I think it's sort of a blessing and a curse, because you want to be very communicative, but at the same time, you want to be able to establish those boundaries with patients and say, look, I have a life outside of work, and I need to be able to be a part of that life, whether it's a home life, family life, doing other things you like to do. And, you really can't lose sight of that. I think, my love language, I always tell my wife, is like sort of validation. And so every time a patient I see in the office says, oh, you're so responsive, or, it's so nice to have a surgeon who sends me a message back right away. I mean, that kind of thing makes me really feel really good about the care that I'm giving my patients and the quality of the care. And I think having those small moments where somebody really appreciates what you're doing behind the scenes is super helpful to prevent burnout, because it really legitimizes the amount of effort that you're putting into something. And when people notice that you're doing things that make you seem like you care, I think it really goes such a long way.
I just want to add to the conversation here, Marney. Josh and I share a physician assistant. We have for a couple years now. And it's definitely a conversation that I think in healthcare and orthopedic surgery and institutionally based is happening more and more around the country. Physician extenders, whether that's your, nurse practitioner, medical assistant, registered nurse, physician assistant, it doesn't matter, what you call them, but somebody to help you with your job. And we're not all going to be able to do all aspects of our job at every minute. Obviously, as orthopedic surgeons, we're in the OR. So our PA, his name's, Trey, but he has been an asset to us to prevent burnout first and foremost, doing things like calls when we're in the OR, or getting things done that we may not have the time or energy to do, prior authorizations with insurance companies, discussing with patients certain expectations or care. There's definitely an aspect I think healthcare administrators need to listen up on, and that is, if you're going to prevent burnout from an employer standpoint, please utilize as much help in the office as possible for your doctors. It goes a very long way. And for those of you surgeons who don't have that in your job, try to ask for it or look for places that may offer those support systems.
Yeah, I think as those type A people that I mentioned before, in my first few years when I didn't have a PA, and even now, the transition between being able to delegate certain tasks is really hard for me to do, because I always feel like I want to do it myself, or otherwise it's not going to get done properly. And that's just sort of been ingrained in my mind since residency, that, if you don't do it yourself, it's not going to get done properly. And so, letting your guard down a little bit and allowing people to showcase their skill set and assist you with things that you may not have time to complete, or, you're, like Vinay said, busy in the OR for, 12 hours and you can't get to things at a certain amount of time. I think understanding the strengths of those people around you and what they can offer and bring to the table is super important, and really just allowing people into your inner circle and be like, look, this is how I like to do things, and just let those people show you that they can do the things that you want them to do. And it really takes a lot of the stress off of you if you can delegate those tasks, which RPA is fantastic at. And it's really made my life and Vinay's life tremendously better, because we're able to focus on things that we may not have been able to focus on before, or we're able to give more effort to the things that we want to allocate our time to. So it's been super helpful.
It's almost like, as A-type driven people, we're our own biggest burnout enemies, to that delegation and setting boundaries point.
Yeah, absolutely. Totally.
So in an ideal scenario, you both talked about, having different faculty that someone can relate to. Maybe, myself as a PGY3 doesn't feel comfortable talking to, Dr. X, but Dr. Y and I have formed this really good bond. Let's say that, I'm feeling fatigued, I'm just feeling off, how do I approach a faculty? What do I say? Do I need to come with a plan? Do I need to say, I think I need to cut back in X, Y, and Z? Do I simply throw out an open-ended statement of, I think I might be experiencing burnout? How can we work through this? How does that look?
Yeah, I think it's any and all of the above. It's incumbent upon the person who's experiencing those symptoms to have the fortitude to reach out to somebody. And it's also incumbent upon the receiver of that information, to understand what's happening in that situation and realize that, hey, someone is coming to me with these types of symptoms. We need to address this right away. And I don't necessarily think it matters the format or the way it's done, if it's formal, informal, but I think just understanding that it's happening. And the first thing I think that the receiver of the information should do is say, look, this can happen to anyone and does happen to everybody, so you're not alone in this. And by not isolating that person or making them feel like they're the only one going through this, I think it assuages a lot of their fears and allows them to open up and be more, and allow themselves to be open to getting help.
Have either of you experienced burnout? And if so, how'd you get through it?
Yeah, I can sort of speak to my experience a little bit. I did a fellowship where it was very hands-off, and I felt like by the end of the year, my clinical skills were not where I thought they should be. I certainly learned a lot about running a practice and how to treat people, and I certainly learned a lot of clinical things, but that tangible confidence was missing. And so when I came to NYU, I really relied on my senior partners a lot for clinical guidance, technical skills, and efficiency. And I really struggled my first year. I started talking to a therapist, I started taking medication, and I think that constantly talking to people and understanding that what I was going through wasn't unique to me was really important. Having my colleagues scrub into cases with me if I didn't feel comfortable, and going over cases in conference with my colleagues was really, really very helpful. And, at one point, I still remember, it's like one of those flashbulb memories. I was in the locker room at the end of the day. I had just done, a few cases, maybe four cases or so. And I was changing, and I thought to myself, I just got through the day and it was okay. And then from there, it was just sort of this exponential growth in my confidence and my ability to think clearly about things. And, my first year, I couldn't focus on anything but my patients. I couldn't focus on research. I couldn't focus on being on committees or really anything else besides doing surgery and performing good patient care. And once that sort of heavy fog lifted, I really was able to branch out a lot more and really propel my career forward. And I really haven't looked back, but that, and now looking back, it's sort of kind of in the distance, and I don't quite remember it that well, but I know in the moment it was really challenging. And not to mention, boards collection was right around the corner from there. So that added to the whole stress level. And once that was all finished, I really felt like I could, hit the ground running and develop my skills a lot better.
Yeah, thanks for sharing. I know, Josh and I have spoken about that first year experience. It's tough coming out into practice, and as a fellowship, director, we have a lot of feedback, and Josh too, as a very involved faculty. We get texts all the time, and I'm sure Josh can vouch for this too. It's easier than it seems when you're in training, coming out and being a surgeon. And we get texts from our fellows every single month, every single year, about how the first year in practice is really crummy. And are they right for the job? Is this the right career for me? Can I do this? What am I doing wrong? Why is it so hard for me? For me personally, look, I think it was more of the home life balance. I actually never lived with my wife prior to my first job. We got engaged during my chief resident year. We did long distance for a year after that during fellowship year. She lived in Philly, I was in California. And then we moved in together, and like Josh said, we're type A orthopedic surgeons. Even though we're both doctors, me and my wife, it's different. She'll admit orthopedic surgeons are nuts. They're on a different level. And when you add NYU orthopedic surgeons to that, it's just like a totally different ballgame in terms of the level of dedication to our craft that people take. And so the hours I was putting in, were just very foreign to her. Even though she was a medicine doctor, specialized, in gastroenterology, it wasn't the same. And so that level of expectation setting hadn't been there. It's different when you're living with someone versus when you're not. When you're not living with someone, you don't realize that someone's going to work at 4:30 in the morning and getting back at X time at night and really doing work at night too. And I had to check myself a little bit in terms of what things were compromisable and what things were not. And so since then, it's still been evolution here with our relationship in terms of work-life balance. And we're talking about that because it's in context of burnout. I think you can get burned out at work. I think you can get burned out at home. And so I think for me personally, it's been really beautiful raising two, little girls, and I love seeing them. And that's been an eye-opener for me in trying to be there when I can for my family. And at the same time, still taking opportunities to make my career, significantly important and training people. That's a big passion of mine. So that's been my experience. It's not done yet. I don't think, being married is a lifelong sport. So, it's going to be, a fun evolution here. But I think that hopefully, like I said, some of these challenges, and so, as Josh said, are distant memories, but they'll always live with us.
What role do you feel hobbies play? Do either of you have any hobbies? For instance, I decided that I needed another hobby besides the gym and work because I will literally fill my whole life with work, partly because I love it, partly because it's just, what I've done. I picked up pickleball. I managed to injure my ankle and my hip within 3 weeks. So orthopedic dream. Do either of you have,
Join the club with our pickleball patients here.
Yes, well, you know what? I'll fly up when I need some help. So, between all of you folks, it'll be great. What role do hobbies play in reducing burnout? And do either of you have hobbies? What do you do? I mean, I know it's probably a mixture of your families. Vinay mentioned raising two beautiful girls, and that. How do you utilize other things besides work to reduce potentially losing that, gusto for life?
Yeah, I've always kind of struggled with this. I always feel like I need to have more hobbies outside of work because even, dinner party conversation, I always kind of am at a loss of what to talk about because I'm always talking with people about orthopedics. So it's hard for me to talk about the news or sports or anything because I'm just not used to that situational kind of context. I like to bake. I think it's very therapeutic and it kind of reminds me of surgery because it's really meticulous. And, like Vinay, I have two young girls and I've tried to involve them in that as well. So, I've kind of combined my enjoyment for baking and the serenity I get from that with hanging out with my two girls, which is, the greatest thing ever. And, honestly, that's one of the things I like to do. I like to swim. I think of all the cardio, I had a Peloton in fellowship and beginning of being an attending, and I kind of got bored of that. But I think swimming really allows you to open up your mind and really just not think about anything while still getting a really good workout. So those are probably the two things I like in addition to spending time with my family.
So I think this is hilarious because I didn't know this about Josh, but I'm gonna actually tell him a funny joke here. My med school roommate used to make fun of me because before our tests, I don't even remember doing this, but Apparently I did. I used to bake like a batch of cookies or something, brownies, whatever, the night before the exams, and totally not in orthopedic surgeon fashion. But that now that we both have two girls and we both bake, we're going to be starting an orthopedic girl dad baking club.
Yeah, there
So
you go.
Yes.
that's coming to a theater near you. Now, I don't disagree at all. I think that something to do with spending time, a family activity that involves everybody. I got a subscription to HelloFresh a couple of years ago, and I don't know, Marnie, if you ever tried some of these subscription cooking meal prep things, but they're actually pretty fun as a family or friend activity, or even just for yourself, just kind of feeling like an accomplishment. Because just like Josh said, it's like doing for us, it's kind of like doing surgery gives us an accomplishment. You fix something, you do something, you have something to show for it at the end. When you involve your family with it, it really becomes like a fun event. So I do that as well sometimes. Now we're gonna have to have a bake off to see who makes the best
Yeah.
the best
Yes.
girl dad brownies. But the other thing I think is you're right. You do need some kind of decompression hobby or something, and we struggle with it as orthopedic surgeons because work it has been everything for so long. So I would encourage people to try something outside the box and try to involve other people in it, because it really is much more meaningful when you have people connecting rather than just an individual. It's nothing wrong with having a solace in doing something yourself, but I find that connectivity is really important.
I just wanted to add two more quick things. One, during my first year when I was having all those, issues with burnout, somebody told me to meditate, and at first I was like, oh, that's never going to work. That's really corny, blah blah blah, all these things, and I kind of dismissed it. And then I tried it. I got to work one morning like a little early, and I downloaded like one of those Headspace things, and I got to tell you, it actually does work a little bit. I think as long as you kind of buy into it and understand that it's not necessarily about the final result, but it's sort of about the process. It's really beneficial. So I would encourage people to, even if it's 5 minutes, just take 5 minutes, listen to one of those, Headspace things, and I actually think you'll feel a lot better. And then the other thing was, I moved out to Long Island after my second year in practice, and I've been driving to work. And after COVID, once COVID started, the commute has been horrendous because everybody now drives. They don't take public transportation. So my commute home can be, hour and a half, 2 hours. And while that seems really, really painful, I actually use it as a time to just decompress. And I can tell you that since I've been commuting like that, there's not one day that I've ever come home angry or upset. I always used to bring my work home with me, and you could see the anger or the frustration on my face when I walked in the door, and like your family picks up on that energy so quickly, especially your young kids. They just see your face. I remember one time I came home and my daughter Charlotte looked at me and she's like, "Dad, are you okay?" And that was like, life changing for me. Like, I don't want my daughter to pick up on that energy. I want her to see me as happy all the time, and and being a good dad and a good husband. And I think that allowing yourself some time to just decompress after the day of work, even if it was a good day, just reflect on the day. What are you going to do differently the next day? What are you going to do the same? I think is a really good exercise for yourself and for your mind to be able to allow yourself the ability to be home and be present. Because if you're home and you're not present, your family's going to know, and it's just going to lead to more problems. And if you're not okay at home and you're not doing well at home, you're never going to be okay at work.
Well, gentlemen, this has been extraordinary. As always, I just am so honored, and I'm just wowed by our conversations together. Girl Dad brownies, I feel like that needs to be made into an apron. I am seeing some Instagram posts of pictures that you're all going to send me with said aprons. And so just wanted to say, on behalf of all the listeners and myself, thank you so much for your candor and, quite frankly, your courage in addressing a conversation like this, especially being in orthopedics.
Thanks, Marnie. I think it's a really important topic, like you said, and I'm glad that you approached us about doing this, because I think it's super important. And the more people hear about it and can relate to it, I think the more it will be discussed and the more we can do to prevent it from even happening.
Yeah, thanks again, Marnie. I really appreciate it. I learn something every time I do one of these, and every time I feel like I connect with people on a greater level. So hopefully we help people connect on a greater level, whoever's listening out there, and I'll take you up on that brownie.
Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marney Reid Presents.